Fibroids are extremely common. By the time a woman hits menopause, about 50% of the population will have fibroids. And in certain genetic or ethnic groups, like Black women, the number is as high as 80%. A fibroid is a muscular tumor, and a tumor doesn't always mean cancer. Tumors can be benign as well, and most fibroids are benign, that grow in the wall of the uterus. So they are muscular tumors of the uterus, but they can be found anywhere. They can be found in the cavity of the uterus, in the wall of the uterus, or elsewhere in the pelvis. And they are important because depending on their location, they can cause bulk symptoms like having to pee frequently or back pain. They can cause bleeding symptoms like heavier periods or more blood loss or more painful periods. And for women who are seeking fertility, they can take up important real estate in the cavity of the uterus. So these are the reasons to treat fibroids. But if a fibroid is found incidentally from an ultrasound that was done, for example, and you don't have any of those symptoms that we just talked about, fibroids can largely be ignored because they are extremely common, almost always benign, and don't cause problems if they are not in the right place at the right time. So perimenopause is a time of tremendous hormone fluctuation, and a lot of women will see growth in their fibroids, where after menopause, a lot of women will see shrinkage of their fibroids. Fibroids should be treated, whether it's perimenopause, earlier or later, if they are causing symptoms. So if they're causing heavy bleeding or bulk symptoms for perimenopausal women, it is important to treat them, and they can be treated with medications. They can be treated by having the blood supply cut off to them, or they can be treated surgically. For women who are aware that they have fibroids but are not really impacted by them, there's no reason to treat them any differently. Can women with fibroids take hormone therapy? The answer is yes. So fibroids are considered hormone-sensitive tumors that are usually benign. And the natural history for a fibroid in menopause is that taking away your own hormones when you go into menopause allows the fibroids to shrink a little. When we give hormones back, we don't give hormones back in the same level that your body makes them in a normal menstrual cycle. So even though you might get a little bit less fibroid shrinkage if you're taking hormone therapy, this is okay, and it is not a reason to avoid taking hormone therapy. But for women who have fibroids in the cavity of the uterus, who start hormone therapy and experience bleeding, it's still important to investigate the bleeding and treat the fibroids so they don't have ongoing bleeding while taking the hormone therapy. Can women with fibroids and perimenopause take hormone therapy? Absolutely. So these are totally distinct entities, and your own perimenopausal hormonal fluctuation is going to have a humongous impact on your fibroids, whereas taking hormone replacement is going to have a tiny impact on your fibroids. So one kind of has nothing to do with the other, but if women are perimenopausal and bothered by their fibroids, the fibroids can be treated independent of the hormone therapy. Does vaginal estrogen increase the risk of fibroids growing? The simple answer is no. Vaginal estrogen is given in doses that are very, very low and shouldn't be absorbed into the system in any kind of significant way. So in turn, we don't expect fibroids to grow or shrink in response to using vaginal hormones because they're not supposed to absorb enough vaginal hormone to make a difference.